going over it right now in class.
Perfect. Let's go get the room ready.
Okay.
The first projection we're going to do is the AP open mouth for the odontoid. What SID would we use?
72?
No, we would actually use 40.
Oh, okay.
So you just bring this and make sure the two areas are lined up. And then, what IR size would we use?
I would think you would use like a 14 by 17.
No, you're just getting a little space on the mouth part, so you just use.
Oh, so you want to use a smaller one?
Yeah, it's just a 10 by 12.
Oh,
Make
okay.
sure everything's lined up. And now we go get the patient.
What are you in for today?
For Olaf? And I see Olaf over here too. Hold on, let me check the birthdays really quick, okay?
Okay.
You're 93. April 1st is the same as on my thing, but the year's different. Let me check yours.
Okay.
95. Oh, okay, then you're the one we need.
Okay.
Alright, so do you want to go ahead and come on in?
Yes, sir.
Okay. Can you repeat your name one more time and your birthday?
Olaf, and my birthday is April 1st, 1995.
Okay, well come on in. So my name is Daisy, and we're going to be doing your x-rays today.
Okay.
By any chance, are you pregnant or maybe pregnant?
Oh, no.
Okay, great, then we can go ahead and continue the exam.
Okay.
Hello, Olaf. My name is Yolanda.
Hi.
I'm going to be the tech today, and this is a student going to be observing.
Okay.
So your next ready?
Oh, yeah. I was doing my gymnastics routine, and I was flipping in the air, turning upside down, and I think I hurt my neck in this area.
Oh, okay. We'll get a couple pictures to see what's going on in there.
Okay.
I'm going to go ahead and put some gloves on.
Am I going to have to lay down for this exam?
No, you'll be standing up.
Okay.
Cool. Okay, you want to come over here?
Sure. Just tell me what to do.
Just watch your head. Go ahead and place your back against the board. Perfect.
Ooh, it's like a real picture.
Yes. Okay, and for this one, you just align the base of the skull and the top of the teeth. Can you smile?
What happens if you don't line up the teeth and the skull?
Well, if your head's too far up, the base of the skull will superimpose the dents.
Mm-hmm.
And if the skull's too far down, the top teeth will superimpose the dents. And you want to be able to see all of it.
Oh, okay.
So that's why you just make sure. Can you smile? Just like that. And then you just want to make sure they're straight. Just like that. And the marker's in the light. And then when they open their mouth, can you open your mouth as big as you can? You want to make sure the CR is right in the middle of the tongue.
Okay.
Just like that. And then we'll give her a shield. Can you hold this in front of your lady parts? Okay, hold just like that. And then just go over here. We'll shut the door. But you always want to keep an eye on your patient. For the AP open mouth projection for C1 and C2 of the cervical spine. Clinical indications. Pathology, particularly fractures involving C1 and C2 and adjacent soft tissue structures. Demonstrates odontoid and Jefferson's fractures. For the anatomy demonstrated, dens and vertebral body of C2, lateral masses and transverse processes of C1, and atlantoaxial joints demonstrated through the open mouth. For the exposure, clear demonstrations of soft tissue margins and of bony margins and trabecular markings of the cervical vertebrae, and no motion.
So your lunch was good?
Yeah, I went to Johnny Carino's.
Me too. Why did you sit with us?
Oh, I don't know.
Oh man. Well, I had a good lunch. I
Good.
think I heard the printer go off.
Is there an order?
Yeah, let me put this down. It's for a C-spine. Can you get comped on these yet?
Not yet. We're still learning about them in class, but I'd like to watch you do it.
Okay, no problem. So we'll just go get everything set up and we'll call the patient in.
Okay.
Okay, let's go. So before you call the patient in, I just wanted to show you like how I set up the room and everything. For the AP axial is what we're going to be starting with.
Okay.
Do you know how much we angle if they're standing up?
20,
And what about if they're laying down?
15.
Okay, So this patient's fine. She's walkie-talkie, so she'll be able to stand over here.
Okay.
She is under 50, so make sure you go ahead and ask for pregnancy before you call her in the room.
Okay.
Okay, and what SID are we using?
40?
Yes.
Okay.
Alright, so here you go. I'll be here waiting.
Okay.
Okay.
Tuesday Q? Oh, hi, I'm from X-Ray. We're gonna be taking pictures of your neck. Can I just check your wristband? Alright, Tuesday Q. And date of birth matches up. Alright, you're my patient, just follow me. We'll be right in here.
Okay, my name is Andrea. What was your name? Suze Q?
Yes.
Okay, and I think you met Cassandra. She's my student for today. So what seemed to happen to you? Having neck problems?
Yes, we're at Six Flags and I was on a roller coaster and I got jerked really hard.
Oh my gosh, I'm sorry. It's
What
really
roller
fun.
coaster were you on?
The Batman.
Oh.
That's good.
Okay. So before we get started, any chance of pregnancy?
No.
Well, you were on a roller coaster, right?
Yeah.
True. Okay.
Okay, so you can go ahead and step over here behind me. I'll put this down.
Like this?
Okay. Actually, you're going to be facing forward. There you go. So we're just going to be doing a front picture of your neck. Cassandra, do you have? Okay, there you go. All right. So where do you center for this projection?
At C4,
Okay. And do you think her head looks good like that?
maybe just a little bit up.
All right. Perfect. So if you can, just line up the bucky.
All right.
All right. Then we're going to put a marker in the light field. Okay, if you can take a small step to your left, a little here. Go a little bit back towards your right, just gonna get you centered. There you go, right there.
So why are we angling like this?
So if they're standing up erect, you're gonna angle 20 degrees to open up their joint spaces between the vertebrae. But
Okay.
if they're laying down, you're gonna do it 15 like we talked about earlier.
All right.
So, looks good right there. We're gonna place this chair in front of you, so be careful not to step forward, okay?
Okay.
This is just a shield for you. And everything's lined up. We're just going to step out and take the picture, okay? Stay just like that.
Okay.
So just make sure your door's closed. And like always, make sure your patient's not moving. Make sure they're okay. And you're going to take the picture. For the AP axial projection of the cervical spine, clinical indications. Pathology involving mid and lower cervical spine, C3 to C7. Demonstrates Clay-Shevler's fractures, compression fractures, and also slipped discs. Anatomy demonstrated C3 to T2 vertebral bodies, space between pedicles, and intervertebral discs are seen clearly. Positioning. Make sure there is no rotation indicated by spinous processes and sternoclavicular joints. The mandible and the base of the skull should superimpose the first two cervical vertebrae. Exposure. Clear demonstration of soft tissue margins and bony margins of the trabecular markings of cervical vertebrae. Make sure there is no motion.
Oh, look, we got an order that just came in.
Okay.
It looks like it's for oblique C-spines. Have you gone over those yet in class?
We're actually doing it right now.
Oh, then that's perfect. We can do it right now on the patient.
Okay.
Okay,
I'll
let's go.
watch.
Alright, so we want to make sure that the room is set up before the patient gets in here. Right now we have it at a 72-inch SID with a 15-degree caudal angle. Do you know why we do the 15-degree caudal angle?
Just to open up the disc spaces.
And also to make the foraminas on the C-spine equal in size and shape.
Okay.
So you want to make sure that's done. We have our 10 by 12 IR already in the bucky here. And all that's left, we have our shield ready, and all that's left is just go get the patient.
Okay.
When you get her, just make sure that you verify her full name, her date of birth, and when she comes in, you can ask her about her pregnancy.
Okay. For Cinnamon.
Oh, that's me.
Hi, my name is Yolanda. I'm from
Hi.
X-Ray.
Hi.
Can I get your wristband?
Mm-hmm.
And your date of birth?
10/9/92.
Okay, you're my patient.
Okay.
Will you come with me?
Okay.
Hi, Cinnamon.
Hi.
My name is Daisy. I'm the tech that'll be helping out. She's the
Okay.
student, Yoli, and she'll be here.
Okay.
And before we get started, is there any chance of pregnancy?
No, there's not.
So what happened?
Okay, this morning I was at the salon and I was getting my hair done, and I'm going to a party this weekend, so I was really excited to look good and do something different. So I was there and I had my head back and I was about to get it washed, and then the chair broke. And so my head just slammed into the little sink that they wash your hair.
Oh my god.
So yeah,
Oh my
that's why.
goodness.
I think I still look good though.
Yeah.
It looks okay?
Yeah, it
Yeah.
totally looks
Okay, good. I was worried about
okay.
that. Okay.
Okay.
Alright,
So
so
come right over here.
Over here?
Yes.
Go ahead and stand against the board here. And what kind of oblique do you want her to have to be in?
45.
Yeah, okay, definitely. So we'll start off with her left side. So we'll put her in 45. So make sure you just turn this way.
Okay.
And then we're going to go ahead and turn on our light. And we'll put our CR at, which C do you want it at?
C4.
Exactly. So we'll move this down a little bit because I think it's not about right on C4. I'm going to move your hair out of the way, okay?
Okay.
I'm going to put it on this side.
Mm-hmm.
And then you want to make sure that it's on C4. So just kind of, it's usually right above C5 in that area. And then we're going to line up our bucky.
Okay.
And we definitely can collimate. We don't need that much space open. So we'll go ahead and close it up to about maybe right there. You want the light kind of like around the top of the ear. And you can collimate in. You don't have to get half of her face. And then we can move her forward by a little bit about right there. You usually want the CR to be centered right about behind the ear. And then again at C4. So I think she looks good right there. All that's left is just to shield her, and we can go take the exposure. Just hold it right there, okay, Cinnamon?
Oh wait, I think we forgot something.
What happened?
We didn't put a marker.
Oh, we didn't. Do you want to go ahead and just make sure that you want to put the L because it's an LAO?
Okay. Sorry, one last thing.
Mm-hmm.
Just like that.
Okay.
Okay. I put my left marker.
All right, so now just want to make sure that she stays still, and then we can expose. Okay, want to get our other cassette. Okay, Cinnamon, you can go ahead and relax.
Okay.
We have one more image to do, so I'm going to go ahead and change out the cassette to a new one.
Okay.
Take this off. Here you go, Yolanda. Do you want to hold on to that? Alright, so go ahead and stand back against this board, and we have one more to do. It's just like the other one, but this time you're facing the opposite way.
Okay.
So go ahead and turn this way at a 40. You want to make sure that they're getting there at 45.
Who's that?
Who?
Him.
I don't see anybody else in here. It's just me, the student, and you.
But his name's Harvey.
No, it's just us in here.
I don't see anything.
Oh.
You don't see
Okay.
anything either, do you?
No.
Maybe it's not that chemicals
Yeah.
from the salon.
I think you're still kind of freaked out from the salon.
Yeah. Let's just get this over with.
Definitely. Go ahead and turn your head that way. And we want to make sure it's at C4 again. And then, yeah, go ahead and turn on the light for me. Go ahead and scoot back just a little, about right there. Okay. We're going to go ahead and put our right marker. This time I'll put it here in the front. Right in the light field. And then make sure she's shielded. And again, we left our SID at 72. We're not going to change it from the first one. Okay, and we want to make sure that she stays still. Okay. So now we just want to make sure she stays still and everything looks good. And expose. Anterior and posterior oblique positions for the cervical spine. The clinical indications are pathology involving the cervical spine and adjacent soft tissue structures, including stenosis involving the intervertebral foramen. For the anterior oblique positions, which is RAO and LAO, they're preferred because of reduced thyroid doses. The anatomy demonstrated on the anterior oblique are the intervertebral foramina and the pedicles on the side of the patient closest to the IR. The intervertebral disc spaces and intervertebral foramina of interest, which are C2 through C7, should be open and uniform in size and shape. Obscured intervertebral foramina and pedicles indicate under rotation. on-end pedicles aligned at the midline of the cervical body, and visualization of zygapophyseal joints indicate over-rotation. Your exposure should have clear demonstration of soft tissue margins and of bony structures and trabecular markings of cervical vertebrae. Make sure there is no motion.
Oh, looks like we got an order in.
Okay. What is it for?
It's for a C-spine. Have you learned those in class yet?
We actually just started going over them.
Alright, well, I'll show you how to do one, so
Okay.
next time you can perform one, and
Okay,
then you
sounds
can get a
good.
comp. So we'll go to the room and set it up real quick before we get the patient.
Okay.
Alright, so we're going to be doing a lateral C-spine. So
Okay.
we're going to have our distance at 72 inches,
All right.
and then we're going to be using a 10 by 12 IR link
Okay.
width. So that's pretty much set up. I'm going to have you go get the patient.
Mhm.
Here's her order.
Okay.
And when she gets in here, we'll ask her about pregnancy.
Okay. Sounds good. I'm looking for Bubbles. Hi. I'm just going to check your bracelet. Okay, my name is Andrea. I'm from X-Ray, so you want to go ahead and follow me this way? Okay. You doing okay today?
Yeah, I've just been having a lot of neck pain.
Oh, I'm sorry. What happened?
Well, I was driving, and
Uh-huh.
this car just comes out of nowhere. So
Oh,
I
no.
braked really hard, and I think I kind of broke my neck, but I'm not too sure. I've just been having a lot of pain.
All right. Well, we'll get everything checked out and send your pictures to the doctor, and he'll give you results. Okay?
Okay.
Okay.
So I'm Cassandra. I'm actually going to be the lead tech, and this is my student. She's going to be observing.
Yes.
Okay.
Before we get started, any chance of pregnancy?
Oh no, darling, no.
Oh, okay.
Okay.
So we'll be right up here.
Go ahead.
I'm going to have you put your left shoulder against the board. Good. So,
Is there any angle on this one?
no, the CR is actually perpendicular to the IR.
Okay.
So, do you know where the CR is going to go?
At C4?
Yes.
Okay.
So, I'm going to have her mid-coronal plane perpendicular. See it right there?
Mhm.
Alright, so just try not to sway back. And I'll have her the CR at C4. Right about there.
Do you want me to line up the Bucky?
Please. I'm just going to collimate down a little bit. Always try to collimate
Okay.
on your patient. Good, right about there. And what marker do you think we should use?
On the left.
And why is that?
Since it's a left lateral, her left arm's against the Bucky.
Yep. So I'll put my marker right here.
Okay.
We always ask the patient to lower their shoulders as much as possible so we get C1 to C7.
Okay.
Alright, so then we'll go out of the room.
Am I supposed to shield on this side?
Oh yes, go ahead and shield her.
Okay. Okay, ma'am. Be careful with the chair, okay?
Okay. And now we can make an exposure.
Okay.
Okay, so we're gonna do it on expiration. Do you know why?
So they can relax and have their shoulders dropped?
Okay.
Okay.
So so if you can ask her how to breathe.
Okay, ma'am. Stay just like that. Go ahead and take a deep breath. Let it out and hold it out.
For the lateral position of the cervical spine, clinical indications. Pathology involving the cervical spine and adjacent soft tissue structures, including spondylosis and osteoarthritis. Anatomy demonstrated. Cervical bodies, intervertebral joint spaces, articular pillars, spinous processes, and zygapophyseal joints. C1 through C7 T1 intervertebral joint spaces are clearly seen. If upper margin of T1 is not demonstrated, additional images such as the cervical thoracic lateral should be obtained. Exposure. Clear demonstration of soft tissue margins, including margins of the trachea and bony margins, and trabecular markings of cervical vertebra. Ensure no motion.
Work, 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 work. You see me heavy work, 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 work. You see me do me dirt, 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 dirt. There's something about that work, 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 work. When you walk a line, line, line.
Okay. I will laugh, I promise.
Are you able to take out any of these earrings?
No.
Okay. Okay, it looks like we have oblique C-spines. Have you gone over those in class yet?
Oh, we're actually doing it right now.
Oh, then that's perfect. We can go do it right now in the class. I mean, in the... Stop!
Oh my god.